Hello, my name is Dr. Alexander Ansrud. I am a board certified plastic surgeon, certified by the American Board of Plastic Surgery, as well as the College of Physicians and Surgeons of Canada. This talk is about abdominoplasty or tummy tuck surgery. I have a special interest in this type of surgery. I finished my plastic surgery training in 2008. In 2015, I spent 6 months working with Dr. Mustafa Hamdi in Brussels, Belgium. It was there that I learned specialized techniques in body contouring and aesthetic surgery. Tummy tuck or abdominoplasty surgery may treat several concerns. It will remove loose abdominal skin and fat. It can remove stretch marks from the abdomen. It can narrow the waist, reduce the lower abdominal bulge. It can reduce skin irritation. As well, it can sometimes reduce back discomfort. Abdominoplasty surgery removes fat from outside the abdominal cavity, as shown in this upper diagram. This is the fat that you can pinch, as shown in the lower diagram. It does not remove fat from inside the abdominal cavity, as shown in the upper diagram. It will not remove the fat that you cannot pinch. Generally speaking, women tend to collect more fat outside the abdominal cavity, the fat that can be pinched, whereas many men, when they gain weight, tend to accumulate more fat inside the abdominal cavity, the fat that cannot be pinched. Who is not a candidate for surgery? People who are unable to have a general anesthetic should not have an abdominoplasty or tummy tuck. Patients who are currently smokers cannot have an abdominoplasty or tummy tuck surgery. Patients must stop smoking for at least 3 months prior to surgery. Patients with a basal metabolic index or weight to height ratio that is not stable should not have surgery. Patients should have a stable basal metabolic index for at least 6 months prior to surgery. Ideally, patients have a basal metabolic index or BMI less than 30 prior to surgery in order to reduce the chance of complications. This diagram is designed to help understand the incisions used for abdominoplasty surgery. For most patients, there is an incision around the umbilicus or belly button. In a mini tummy tuck, a very small incision is made along the lower area or midline. This is used for patients who require very little skin and fat removal and are essentially having a tummy tuck simply to tighten the stomach muscles. The procedure known as a standard tummy tuck or abdominoplasty generally goes from hip bone to hip bone. Most patients undergoing an abdominoplasty surgery have an extended abdominoplasty incision, one that goes past the hip, across the center midline, and past the opposite hip. By extending the incision, the maximal amount of fat and skin can be removed. The lower incision can be placed wherever the patient desires. It is something that should be discussed with Dr. Ansrud at the time of consultation and before surgery. The upper incision is most often placed just above the belly button.
such that the final incision line, upper and lower, form an ellipse or football shape. The area between the upper and lower incision, in this case the blue lines, is what is generally removed during surgery. As one can see, most of the skin and fat is removed from the central portion. As we move to the outside or lateral portions, much less tissue and skin can be removed. This is why an extended incision abdominoplasty can be so much more effective or powerful. After the lower abdominal incision is made, the skin on the abdomen is lifted and brought downward, such that the skin from the initial lower incision is brought much, much further down, and the skin in the area of the upper incision is now brought down to the region of the lower incision where it is trimmed. As can be seen from this diagram, the area of skin that once housed the belly button is removed, and a new incision is made to allow for a new belly button to be created. These two pictures show variants of abdominoplasty surgeries that are used, although less commonly. For patients who have significant scars on their abdomen, they may be best treated with a reverse abdominoplasty, as seen on the left. In a reverse abdominoplasty, the incision line or scar is just under the breast tissue. For patients who have had massive weight loss and require removal of more central skin, a fleur-de-lis abdominoplasty is performed. This results in the addition of a vertical scar. This is in addition to the standard horizontal scar. At the time of abdominoplasty surgery, many patients undergo a diastasis rectus repair. For many women, during child delivery, pregnancy, or C-section, the rectus muscles are pulled apart. This leads to an opening or a bulge in the area between the rectus muscles, as seen here on the left. Regardless of the amount of activity or exercise that is performed, the rectus muscles will not heal together again without surgery. At the time of abdominoplasty surgery, it is very common to suture the rectus muscles back together to repair this hernia, to reduce the lower abdominal wall bulge, and to tighten or narrow the waistline. It is this part of the surgery that results in most of the pain and discomfort after surgery. If a rectus repair is done after surgery, patients have more discomfort in the postoperative period. They are also required to wear an abdominal binder or garter for 6 weeks and not do any core muscle activities. Patients undergoing abdominoplasty surgery may have certain side effects. They will typically have a scar along the lower abdomen or pelvic area and one around the belly button. They will typically have reduced sensation over the abdomen, which generally recovers except for the area right around the scar. After surgery, patients will have some discomfort or pain. The pain is almost entirely due to the repair of the rectus diastasis or hernia repair. Patients may also have complications. Patients may have collections of fluid called seromas, Patients may have problems with wound healing and breakdown of the wound. It is possible to have some asymmetry, loss of sensation to the upper thigh region, loss of the belly button, bleeding, fat necrosis or breakdown of some of the deeper fat tissue, infection, problems with anesthesia, injury to the organs underneath the muscles, a blood clot that can form in the leg, a DVT, or one that can go to the lung called a PE or pulmonary embolus, which can be quite serious and even fatal. Some patients may need further surgery for a minor or significant complication. Wound breakdown is the most common significant problem. When this occurs, the patient develops scabbing along the central portion of the incision. This scabbed area will eventually lead to breakdown of the skin. This is an example of a patient with wound breakdown after abdominoplasty surgery. The picture shows the patient before surgery, 2 weeks after surgery, where the patient has a large area of wound breakdown, as well as 3 months after surgery, where the patient has a slightly widened scar from the wound breakdown. Treatment of this includes dressing changes that may need to be done once or twice a day for 6 to 12 weeks. In the end, patients may have a slightly wider scar. The major risk factor for wound breakdown is cigarette smoking. Patients must stop all nicotine products, including vape smoking and cigarette smoking, at least 3 months before surgery and for 2 months after surgery. Other risks include a basal metabolic index greater than 30, diabetes, advanced age, or prior surgical incisions on the abdominal wall, such as a gallbladder incision from an open gallbladder surgery as shown in this patient. These types of incisions can impair the flow of blood and nutrition to the healing abdominal wall after surgery. Most patients recover without any problem. Surgery is generally a day surgery. Patients go home the same day. For patients living outside Duncan, they will need to stay overnight for 1 night. Patients are encouraged to ambulate or walk immediately after surgery and move their ankles to prevent blood clots. Patients are unable to go swimming or submerge in a bath for 6 weeks. However, you may shower immediately. Drains are removed after 7 to 12 days. Return to sedentary activity is typically at 2 to 4 weeks, and use of a compression garment continues for 6 weeks. This is an example of a woman using a compression garment. The compression garment is used when a patient has a rectus diastasis repair or tightening of the muscles. In addition, for those patients having a rectus diastasis repair, there is no core muscle activation for 6 weeks. Patients can resume full activities at 6 weeks, and the final result is usually achieved by 12 months. In summary, non-smokers with a basal metabolic index less than 30 are excellent candidates for abdominoplasty surgery. Surgery can improve the appearance of the abdominal contour and skin. Patients may return to sedentary activities at approximately 2 weeks after surgery and full activities at 6 weeks after surgery. This is an example of a patient from our practice. This lady is approximately 50 years old and has undergone breast surgery to lift the breast tissue as well as abdominoplasty to remove the excess abdominal skin and fat. This is the same patient in a side view. The surgery removes excess abdominal skin and fat and also reduces the lower abdominal bulge by tightening the rectus muscle. This is another patient who has had abdominoplasty surgery for removal of excess skin and fat. This is the same patient. She is in her 60s, and this is a picture from the side. The placement of the abdominal scar is discussed with the patients beforehand. The scar can be situated in such a way that it hides under the preferred undergarments of the patient. This is something that Dr. Ansrud can discuss with you before the surgery, so that the scars are placed in an area that you prefer most. This case is a lady who's lost a significant amount of weight. She has lost several hundred pounds. As a result, a standard abdominoplasty would not remove enough skin to achieve the goals she desired. For these reasons, an incision was made transversely or horizontally across the abdomen, as in a standard abdominoplasty, and a second incision was made vertically, and this is a fleur-de-lis abdominoplasty. The second vertical incision allows removal of an increased amount of midline tissue. As a result, the patient does have a vertical scar, as well as the traditional horizontal scar. However, this surgery allows increased removal of horizontal skin excess in patients who have had massive weight loss. This patient did not undergo plication of the rectus muscles or tightening of the muscles. As a result, she did not require the use of a binder after surgery. She did not have significant pain after surgery. In fact, this patient took extra strength Tylenol for 2 days postoperatively, and this was her only pain control after surgery. Thank you very much for watching this video. Please let us know if you found it helpful and provide us with your feedback and comments. We're always happy to see you in Duncan at our office or on Salt Spring Island.